So healthy aging is all about supporting people to continue living their lives in the way that they value. So continue to do activities, continuing to be connected to the communities, whether or not they have specific diseases or conditions. So we can age healthily even if we have specific diseases and conditions. How can we minimise the impact on those things so they don't stop us doing the things that we value?
Aging is not something that just happens when you're old. We're all aging. As those demographics shift, the importance of aging healthily is just going to be incredibly important in terms of the well-being of our population.
So within the Health and Care Technologies Institute, we have a group specifically looking at healthy aging. So a range of researchers from different subjects and disciplines, understanding the kinds of things that are associated with aging. How can we diagnose those things earlier?
For me personally, it's very exciting that we can actually start working towards making a difference in the real world. What we see is that there are less and less people working in healthcare, which means that there is a need for technology to jump in.
One of the things that we've got to be really mindful of is when we design new technologies, innovations, using data in different ways, that we do those in a way that genuinely benefits people. How do we design solutions that reduce inequalities so that it's not just some people who enjoy healthy aging, but that everybody?
At the top of the decision-making tree is, what would the patients want us to do? What is the direction of travel for the project that has the maximum possible probability and chance of delivering real-world impact for them?
The research that we do is only done effectively when we have the voices of those with lived experience involved. So whether that's working with older autistic people, whether that's working with minority ethnic communities, whether that's working with people with a specific disease or condition, their experiences right from the start of the process change the way that we do the research for the better.
The impact of our work with autistic people will have wider impact, because if we get it right for autistic people who have lots of barriers for social access, then we're probably going to help lots of other areas as well. So in terms of technology and technology advances, we can see where technology might really help in terms of identifying ill health and helping triage that, but also help with that communication between the autistic person and the professional.
So when Scottish Autism first started our research programme about 10 years ago, we really reached out and tried to make contact with the wider research community here in Scotland. And Mary and myself found very quickly we had a shared ethos in terms of looking to do participatory and co-produced research. And we could see a real need to look at this question about ageing and the need for better services as people age.
What I say is that our tech is always a tool in the hand of the communities and the caregivers in the end. So we are not trying to solve the problems just because technology can. We were trying to solve the problem with the people that are needed to solve the problems.
Some of the things that we're particularly excited about are the way that our researchers in the healthy aging theme are using design-led innovations to support people living with dementia to live independently. Our colleagues in robotics and AI trialling new assistive technologies that allow people to remain living in their own home or moving into assisted care, but doing that in a way that they feel that they still have ownership and agency.
When we're talking about artificial intelligence and robotics in care settings, we still have to understand how this technology will be used by carers. The technology we are designing is supposed to help them to run more efficiently their practice and to augment what they normally do. As part of this work strand, we are working in collaboration with the like of Napier University and especially with their master programs in occupational therapy.
So we're really interested in working in partnership with Heriot-Watt University to think about how our colleagues in practice, occupational therapists in this case, to think about how we can take that technology and use it to enhance our practice and therefore crucially the outcomes of people that we work for. So in this case, we're looking at people living with dementia and how we might be able to use robotics to enhance outcomes for people living with dementia in terms of their discharge from hospital back home into the community.
Forming those key partnerships with the right clinical collaborators is key, because that's how you start off on the right foot. That's how you find the right problems that you can then use your expertise to then address.
Can we, as an institute, contribute to making people's lives not just longer, but much more importantly, healthier, so that we're reducing the number of years that people live in illness or infirmity, and increasing the number of years that people live in good health?